I would say we live in a society where people can be obsessed with sex. You see it advertised oftentimes. It could be on billboards, it's on commercials, and then simultaneously terrified of actually deeply talking about sex because there's an over-sexualized society.
Christene, welcome to Discover More.
Yes, thank you for having me on here. I'm excited to be here.
Excited to kick off this historical moment as a first sex therapist on the podcast. I want to ask you this question. Is it true that sex therapy is only for those who struggle with sexual problems within their relationships? Why or why not?
That is a great question. So I think that, and I have a biased opinion around this, so I'll be transparent about that. I think everyone can benefit from sex therapy in some way, shape, or form. And you don't even have to be in a relationship or be having casual sex to benefit from that, because we all have a relationship to sex, whether that is sex with ourselves through masturbation, for example, or whether that's sex with a partner or numerous partners if you're having sex with different people. We all have a relationship to sex, and we've all learned how to relate to sex from a very young age, even if that meant that our caregivers spoke about it openly or didn't speak about it at all, which still gives a different type of message, or were very overtly shaming around it, or you could experience or feel your caregiver's discomfort when it got brought up or when it showed up on TV. I think sex is all around us. So I think definitely people can benefit from sex therapy, even if they don't have major sexual health concerns. Maybe they just want to better understand their sexual selves, or maybe they want to better understand how to communicate with their partner or partners, even if they're not necessarily having specific problems when it comes to sex.
My favorite mental health adage, Christene, is whatever does not get expressed gets depressed. So we must express openly. I think that ties into what you just said beautifully, right? What is the impact of us feeling shameful or nervous and shy discussing sexual health from your experience?
Yeah, there is a lot of shame for people. And sometimes it is very clear for someone when they're experiencing sexual shame. And then sometimes, because it's so ingrained into the society, our American society more specifically, I would say we live in a society where people can be obsessed with sex. You see it advertised oftentimes. It could be on billboards, it's on commercials, and then simultaneously terrified of actually deeply talking about sex because there's an over-sexualized society. And then when we get to the actual depth of talking about sex and the vulnerability around that, then people can actually have a lot of shame when we think about it from that lens rather than purely the over-sexualized society.
And that also impacts our perceptions of emotional intimacy, because anytime, as you said, in our fabrics of society, sex is every corner. Carl's Jr., a juicy double patty burger, but there is a lady in a bikini eating that burger, right? I was like, what? How does it increase my appetite for burgers? But sex sells. It's a timeless marketing tactic for the longest time. But the downside, I think the implicit message it's sending, as you talked about the messaging, right? Explicit and implicit is, just by catering or going toward or striving towards sex, that's all that matters. But then where is the emotional intimacy in this conversation?
Yeah, you bring up a helpful point about how much sex sells, because in that example, and I haven't seen that commercial in many years, but I remember it. I remember seeing that growing up, and the idea of how much that can lure people into eating at that restaurant. And then at the same time, when you think about it, you're just like, that could be a really shitty burger, but they have this person that they think people will find really attractive. And then it's like, oh, okay, let's eat at that restaurant. It is rippled out and sprinkled throughout so many interactions and so much social media.
So in that sense, because it does ripple out, can you share some of the most common, maybe misconceptions Your clients come to you regarding their sexual health, sexual shame, sexual liberation. Because as you know, half of what we do as therapists is psychoeducations, also addressing or correcting a lot of the misconceptions they already carry within.
Yeah. I think one of the most common concerns that people have in general when it comes to their sexual health or how they're functioning sexually is, am I normal? Is this normal? Something that they might be struggling with. And oftentimes for many people, their main form of sex education is through porn. Porn can serve many purposes. I personally don't think, and as a clinician, don't think it should be the form of sex education for people. It oftentimes ends up being that way because of the lack of sex education, either in school systems or from caregivers. So when people are trying to understand what's happening for them or trying to better understand their sexuality, or they turn to what's accessible, and oftentimes that's porn. So I think to answer your question, that one of the common things that comes up for people, there's many different sexual health issues that can come up for people, but I think one underlying question when all of those questions come up is, am I normal? Is this normal? Is what I'm concerned about normal? Is my partner normal?
And I think the word normal is a little bit sensitive nowadays, right? Aside from the PC culture, but statistically, there's nothing wrong with the word normal. It's just statistically most common within the bell curve. That's just what normal means. But of course, intention behind that word matters. So when a person does come to you, say, Christene, am I normal? I watch porn 12 times a day. I do X, Y, and Z. Because of this, I struggle with X, Y, and Z. Like, what are some of the responses that you do to really establish the emotional safety? Because unless we address stigma, no real fruitful conversations can take place.
Yeah. You bring up a great point, because oftentimes when people come to me and share or ask questions about the sexual concerns that they have, sometimes I'm potentially the first person that they have shared these concerns with, including even if they've been in a long-term partnership. Sometimes because they just don't know how to, or haven't found the words to, or articulate what's happening for them. So I think the stigma around even bringing forth that they have questions or concerns about sex with self or sex with a partner, that oftentimes is a barrier for people to initially seek out the support. So once they seek out the support and then I have them in session with me, I highlight from the very beginning, even on the initial phone call before I start working with them, of how much I appreciate that they're potentially going out of their comfort zone and even seeking support for this. Because it is a big deal. It is a big deal for a lot of people. For some people, it might not be. It might be pretty easy to talk about any sex-related concerns. But for some people, if this is the first time that they're really diving deep into this, after decades and decades of something that they might be struggling with, that takes a lot of courage to do that. So I want to be able to highlight that for someone, that it takes a lot for them to show up. I want them to be able to acknowledge that.
Yeah, what you said really strikes a core, because you said that even certain individuals who's been in decades of partnership, long-term relationship with their partner, they've never really had a fruitful discussions or in-depth discussions about their sexual health, maybe their sexual compatibilities, maybe some of the qualms they have about each other's sexual performance, or anything in between. That's crazy to me, right? Like, you've been naked, you've had sex, you've done everything that's air quote intimate and vulnerable perceived by the society for decades, 10, 20, 30 years. Yet they've never actually had an open conversation with each other about this topic that they deeply care about. Like, I think that's the implicit message that we're dealing with.
Yeah, there are people that have shared with me, and some of your listeners may have experienced that it can feel easier to have some sort of sexual experience with someone and then not talk about it. Because the sexual experience might not feel that vulnerable to them, depending on the person, but the talking about it might feel deeply vulnerable. So sometimes people would rather have any sort of sex and then not have to actually talk about it. Maybe they talk about it at a surface level, but to actually talk about deep desires and the vulnerability around that, sometimes people are just like, I don't think I'm going to go there.
That's interesting. You're saying that because sex is so hyper normalized in the United States, the sex itself is could be a casual, could be a superficial, could be a very low risk, low stake situations. But then actually acknowledging and speaking about it makes it really real. And you're like, whoa, we could have sex naked after seeing each other for the first time at a bar without knowing anything about each other. But talking about it, I was like, oh no, that's too real for me. No, that's too serious. Let's not go there.
Going back to the piece about everyone has a relationship to sex. For some people, their relationship to sex could be that it's very sacred and they are very intentional about who they decide to have any sort of sex with. And then for someone else, they might have a very different relationship to sex, that having casual sex is not, it doesn't feel like all that special to them. They do it for fun and for pleasure, and they don't have to have or necessarily want to have a deep emotional connection to the people they're having sex with. And there's no good, bad, right, or wrong. It's just getting a better understanding from that person how they relate to sex and what works well for them, and then things that are their downsides to that, of how you're relating to sex or their potential consequences to it, rather than labeling it as good, bad, right, wrong, because that can add to the shame around it.
Self-judgments definitely does not help anyone. And my brain is in the wave of implicit, I suppose, because what I'm also thinking is I really believe in to cultivate anything meaningful, you have to partake in meaningfully. Like meaningless activities does not cultivate meaningful relationships. If you're stacking meaningful sex with meaningless conversations after the fact, you're also priming your brain to view sex as meaningless over time. So in a way, you're giving away your power and sacredness of this intimate moment that you share, regardless of how you view it, religiously, culturally, interpersonally.
And I want to add also that sometimes when people think about the idea of someone having sexual shame, they might have a visualization of how they imagine that person were to look. And the misconception might be someone that is very reserved, or someone that is a prude, or someone that is not open sexually. People just might have that misconception. And I think it can be confusing for others, because I have worked with people in which they have a lot of sexual shame and they're having a lot of sex with different people. And on the outside, it might be confusing. So you're like, oh, that person doesn't have sexual shame. They're hooking up with all these people. Sometimes their shame might manifest in different ways. It might manifest in terms of not really opening up sexually to people. And then it also might manifest in the form of, I'm going to try to look as though I don't have sexual shame by having sex with all these people, but I have a lot of deep shame about it. So that's, I think, helpful to know too, because you might be partnered with someone and or you might have had casual sex with someone and think they don't have sexual shame because you know their sexual history, or you see that they're sexually open with you. But how open is actually open? Because being sexually open with your body might not mean that someone is open emotionally. Sometimes those are aligned, sometimes they're not.
That's crazy that you went there, because I think you tapped into my brainwaves. I wasn't going to share this because this is more about you, but I'll self-disclose very briefly. I talked about this on the podcast where I was able to heal through my own sexual trauma. I was sexually assaulted in college and it took me 7 years to heal. But the catalyzing point of healing was through psychedelic, magic mushrooms, right? Psilocybin. That's why I'm advocating for psychedelic assisted therapy. I'm also working through my licensure and certification in psychedelic assisted therapy, because I'm both a practitioner, but also a beneficiary of the psychedelic medicine. But I share that because I was part of that category you just talked about, right? I was part of Greek life, and that Greek life, I guess, contributed to me, like my sexual assaults. And the latest research shows that about 1 in 7 men get sexually assaulted, right? And of course, the woman's sexual assault is more explicit and a lot more talked about, as they should. At the same time, a lot of men are also victims to sexual assaults. So because of that, I had a lot of tremendous sexual shame because of my religiosity. At the same time, my compensatory mechanism to overcompensate that, I chose hook up with a lot of people, right? Because, oh, you took this from me, so I'm going to do this back to you. Like, of course, it was all consensual. I never did anything forcibly. At the same time, for the longest time until my mid to late 20s, when I was healed in 2017, I really continued to grapple with that sexual shame. And as you said, emotional was not connected to that at all. It was just an act, right? But then afterwards, I'll deal with a lot of guilt, a lot of shame, and I'll feel bad, which leads to substance use, like drinking alcohol, and then perpetuate the same behavior the next weekend, even though I've been just like beating myself up to that weekend to begin with.
I really appreciate you sharing that, because I think that is an experience that is unfortunately and also understandably more common than people think, because a lot of people just don't talk about it. So they don't realize how common that is. And especially for many men, it can be add an additional layer of shame to share about a sexual trauma or a sexual assault that they experienced, because for many reasons, but especially depending on who the aggressor was or who the perpetrator was, they might have the narrative of, oh, I should have been able to stop that, or should have been able to say something, or I should have done something differently. And I'm a guy. Like, how did I allow that to happen to me? There's so many layers around that, adding more shame for men when there's sexual assault or sexual trauma. So I really appreciate you sharing about that part of your history, because it happens so often. And 1 in 7, it's a really sad number to think about how many people are struggling with that. And it's hard enough to struggle with the implications of having experienced that. It's hard enough to struggle with that, even if you're getting support for it. But if you're essentially suffering in silence by not getting support for it, then the shame can compound, because now it's this big thing that can have had a huge impact on you, and then just nobody knows that it happened.
Yeah, nothing I love more than working through accumulative trauma. But of course, like I said, I was able to heal through that. And because of that healing, I was able to get committed into my lifelong partnership, recently get engaged to my fiance after 3 years of dating. But that's what healing means to me, right? It's not just another buzzword that TikTokers are throwing around nowadays. Healing allows you to recommit to the fear points that sent you away and distant and far removed. What's sacred for me to begin with. And my sexual trauma, I guess, like sent me away from committed relationships for those 7-8 years of healing. But after that, I'm right back at it. And that's why I was really excited to learn about your topics, as you can tell why. That's why we are doing this 6 a.m. in my time, right? But I really do feel like sexual health, sexual liberations are really, really important topics, especially in light of the rapid rise of porn addiction landscape.
With porn addiction or compulsive use around any sort of sex, whether it's with porn, whether it's masturbation, or compulsively having sex with different partners, that's a struggle, I think, that has been increasing for people over time, especially, I mean, the internet has been around for a while now, but the increase of the accessibility, if someone becomes addicted to or has compulsive use of porn, that has been rising just because it's so accessible. It's so accessible. So, and that ends up being, for some people, they can have a healthy relationship to porn. For other people, not so much, and there can be consequences around it. So, yeah, I'm glad that you brought that up.
Right. Could we, I wasn't going to go into the field of porn because it's very complex and nuanced. And like you said, I don't want certain people to label porn as, oh, it's the evil root of all evil. And I also don't want anyone to label porn as, oh, it's a great tool for sexual liberation, because truth is always in the middle. But since we brought it up, if you don't mind, I'm curious how many of your clients, just based on your patterns, your correlation and causation, are coming to you for their sexual problems, whether it's premature ejaculations, their inability to actually perform in light of actual intimate moments because of excessive consumptions, or anywhere in between, that came to you are actually correlated or caused or attributable to their porn use?
I would say a solid amount of clients. I wouldn't say porn would be the only reason that someone might be struggling with sexual health concerns, because there's many reasons why someone can. That comes up fairly frequently. And I think part of that is probably because of one of my specialties, which is compulsive, when people are struggling with compulsive sex, or partners of those that's struggling with compulsive sex or compulsive porn use. So I think partly because of my specialty, people reach out to me when they're struggling with that. And then some of the consequences that might come from their compulsive porn use can be that it's having an impact on their romantic relationship, or it's impacting their ability to get or maintain an erection, or it's impacting them coming more quickly than they would like, or taking too long to come, longer than they would like. So it can ripple out in these different ways. But there's also many reasons that can contribute to that. That's not just porn. That's just one of them for some people.
So you're saying that not one thing contributes to any issues that we deal with day to day?
Yes. Yeah. Oh, wow.
Like, what a surprise. People's fixations over just oversimplified causes, right? It's crazy.
I want to add to something that, as you were sharing about this, because I think language is also really powerful, because language can inform our experience and can inform how we feel about something. So when I work with people, I'm very mindful around the word choice that they use when they're talking about the concerns they have. And these are very common phrases that people use, like premature ejaculation. And it was one of the ones that you mentioned. And then also you've said the word performance a few times, because those are so common to use when people are struggling with sex concerns. But when we think about the word performance and how it can inadvertently add a level of anxiety already just by using that word for someone when they're talking about, I can't perform, or I didn't perform when I tried this, because it adds this element of our sex should look a certain way. And the way in which I show up to this sexual experience should look a certain way if I'm performing. I wanted to bring that up because I think sometimes without thinking it, that can add anxiety already for someone when they're struggling with a sex concern, when they are viewing it as, oh, I didn't perform.
Yeah. Also, like, premature means what is mature, right?
Yeah,
like,
exactly.
Who decides that? Is there a ruling panelist of the gods of sex who watch over you that, oh, no, that was premature by 7 seconds?
Yeah.
And great point. Yeah, duly noted.
Yeah.
I do agree because...
Yeah, the word premature.
Yeah, because it's like priming, right?
And when people are trying to share about their experience and they're used to using terms like that, let's say, for example, with performance, rather than someone saying, oh, I didn't perform, I ask them to be more specific around what they mean. And maybe when they say I didn't perform, maybe they meant I couldn't maintain my erection as long as I would want to, or my erection wasn't as hard as I wanted it to be able to do this type of sex. So it's more specific around what they're struggling with rather than I couldn't perform.
Specificity, that's true. Because I think the more general and broad, the more loose it becomes and the harder it is for us to address concretely.
Yes. Yeah, exactly.
Great point. So I do want to go into something you brought up, which is like sex addiction or compulsory sex behaviors, as you called it. I think I would like to hold some space for you to go deep into this in the field of sex addictions. What it really is, because I think we need to recontextualize everything. So for you to recontextualize it, because there's a lot of misconceptions, fallacies around it, and B, why it's a real thing, right? Because a lot of, I think, women especially, and a lot of men too, but a lot of women, they like to sort of like dismiss, oh, they did this because of sex addiction. That's not real. It's just an excuse. They're using that as a cop-out, as a scapegoat to get away from their being a responsible partner. Of course, I'm a veteran, so I do believe in personal accountability, personal agencies, and personal responsibilities. And every action has its consequences, period. At the same time, addiction is a brain disease. It's not always permanent, but it's a very formidable change of patterns in your brain, as you know, right? And that's like porn addictions, food addictions, substance use, anything in between. So like, what is sex addictions and why is it real?
I'm really glad that you brought this up because I think there's a lot of controversy around the idea of sex addiction and compulsive sexual behavior. So I have two main specialties. One of them is sex addiction, and then the other one is sex therapy. And those are essentially two different camps. And sometimes there might be contradictions around how those two camps view sex addiction and compulsive sex. I want to share that piece because that's the lens in which I'm going to answer your question through. With sex addiction, it is essentially when someone is experiencing how they express their form of sex. That could be with masturbation, that could be with watching porn, that could be with having sex with a partner, that there's an element of it that feels out of control. So that is a very basic way of describing that. But when we think about different forms of addictions, like let's say to marijuana, to cocaine, to alcohol, there's an element of it that can feel out of control for someone. So there's that piece. There's elements of withdrawal that happen when someone tries to decrease or stop their use of these different substances, or in this case, it could be sex or porn. There's an element of when I try to stop or decrease, I'm having issues being able to do that. So it's like trying to do it, but trying to stop or decrease, but having struggles or not being able to. There's also an element of I'm continuing this despite the consequences. Mm-hmm. So that could be with different substances, including sex and porn. So with those elements, and there's also an increased tolerance. Mm-hmm. So let's say someone watches a type of porn or watches porn, and then over time they're like, oh, that doesn't do it for me. It's not really all that arousing, or the amount of time, it's not enough. So then there's an increase in the intensity maybe of the type of porn they're watching. So these different elements, similar to different addictions, if we think about like an increased tolerance, that there's withdrawal, you're continuing to use despite the consequences, there's an element that feels out of control. Looking at some of these things can also fall under when someone is struggling with sex. It's just like a different form of a different substance that they're using. And what makes something like sex addiction more challenging than if someone were struggling with a different type of substance is that it's a process addiction. The idea around this is that if someone struggled with alcohol or cigarettes or marijuana, cocaine, it would be very challenging if you have an addiction to those things to live your life without those things. It would be very challenging. It's doable. It would take a lot of work. And with things like sex addiction, or if someone had a food addiction, you still have to have a relationship to sex, unless you're going to become a priest. But still, you'll still have to learn how to have a relationship to your own self sexually. Or if someone has a food addiction, you have to still learn how to have a relationship to food, healthier relationship to food. So that makes an addiction like sex much more challenging because it's more complex than if someone had an addiction to a different substance. You have to still learn to have a relationship to that thing. You can't just completely cut it out of your life. So I think that adds more layers around people who might be struggling with compulsive porn use or compulsive sex or compulsive masturbation, because it's not as clear cut as other addictions.
That's great. And I love the DSM-5 criteria you just listed out, right? For substance use disorder, but it is exactly the same as sex addiction, it sounds like.
Yeah. And some of the clients that I have worked with and their partners too, the way in which they describe their struggles with, their concerns with, the heartbreak around, the pain around their addiction when it comes to sex or porn, the same words that they're using, it's as if they're describing an addiction to a substance. It sounds the same, except that there's more layers to it when it's with sex. But sometimes the withdrawal that they experience, or the amount of anxiety around it, the confusion, the out of control element, like all of those elements are still there from when I hear clients talking about it with me.
In addition to that, you also add the individual genetic predisposition that individuals have, in addition to their religious associations, their cultural influence, parental influence.
Yeah, and I want to also bring up a point too, that one misconception about the field of sex addiction is that it's so shaming about sex, and it's really shaming about porn, and it's anti-sex. And me being in both fields of sex therapy and also sex addiction, I don't think that's true. I think that for a lot of people in the sex addiction field, it is more so wanting to help the client better understand and rediscover or discover for the first time what is true sexual health for them. Because maybe most of the experiences they've had have been either obsessive or compulsive or coping, but in an unhealthy way. So it is still about sexual health. It's not anti-sex or shaming about sex and porn. It's just wanting the person to better understand what is sexual health for them.
I think the biggest difference I can see from my end, aside from the similar tenets of addictions, the withdrawal, the tolerance, the whole nine. It's more stigmatized, I think, not because it's more taboo necessarily, but because it's less talked about. I think substance use and substance addiction through AA 12 steps, which are amazing, have really paved a lot of ways in the US, at least, for us to talk about it. And still, even within substance use, certain people and even certain counselors, they rejected the idea that addiction is a brain disease. Like, these are facts. Just do your more research, like read up on your literature, right? These are just facts. These are not opinions. And likewise, of course, the same thing for sex addiction. And one thing I want to highlight, what you said, Christene, that I think is really powerful is we have to learn how to deal with the relationship. Because I think by withdrawing from it or by cutting it out, for example, I've been sober from alcohol for 3 years and 4 months now. I partake in cannabis, as we talked about before recording, and also psychedelics. But I don't drink anymore. Haven't had a sip of alcohol in 3 years and 4 months. I'm never going to drink again because of my past experiences, some of what we just discussed, in addition to other crazy experiences I've had because of alcohol. But a friend and a guest told me, Joshua Greenfield, he told me that I respect what you're doing, and as long as it fits your life, that works. But one thing he urged me to think about is by cutting something out entirely from your life, you're also cutting out the relationship with that thing. And I think if we hate or if we self-judge and self-shame our acts, our behaviors of watching porn or masturbations or self-sex, as you said it, if we hate that of ourselves or a part of ourselves, that will trigger through and actually will become a reverse or a different type of identity in a way.
Yeah, because it can still feel as though it has some control over you if there's such a no, I can't. I absolutely can't do this. It can be very confusing for someone if you're not really being intentional and mindful and have thoroughly processed your decision to not engage or not have a relationship with a certain thing.
I have a personal curiosity. It's a little bit non-related, but like right now, the dynamic is I'm a man, you're a woman. And of course, we're both therapists. So I talk about sex with my clients sometimes. And as we both know, it's only awkward if you make it awkward, right? Because it's our job to uphold the space so clients feel comfortable sharing what they feel very uncomfortable about. So us aside, I'm still thinking about the gender dynamics in a way. Like, I'm guessing a good portion of your clients are men.
Yes. Yeah.
So like, how do they feel about the different gender dynamics in place? Since you're a woman, there are men, especially we're talking about ejaculation, masturbation, sex, all these things. And I'm sure there's a little bit of like, ooh, but like, how does that happen in your dynamics with men clients, especially?
Yeah, I appreciate you bringing that up because it comes up fairly often. Luckily, in my experience, not enough to the degree that it gets in the way of someone's progress or someone's healing process. But it's something that I have, sometimes a client will bring it up. And if they don't, oftentimes I will bring it up just because I want to be mindful that might add to the shame because I'm a woman and they're not, or they don't identify as one. And in some ways, that process of me being a woman can be more triggering for them or more healing for them, depending on the experience that they've had of how to talk about sex in general, but how to talk about it with a woman. And I think sometimes I have absolutely heard clients say, oh, this feels weird because you're a woman, or, oh, I don't want to offend you because you're a woman, because maybe some of the things that they're sharing are ways in which experiences that they've had with women that they're not proud of, or ways in which they have crossed boundaries with women, or ways in which they've caused some sort of harm towards a woman. So that piece can come up too and can add to the difficulty of someone bringing it up. And then also I think about how deeply powerful that can be if they're able to come to a place and share that with me, and then us be able to talk about it. What is it like for them to practice holding themselves accountable? Maybe if it's not yet directly to the person that they caused harm to, but to a woman, Like, what is that like for them? So there are many layers of how challenging that can be for someone, for a client, and then also how powerful and how healing it can be. But it does come up pretty often.
I wanted to share some quick education around that, right? Because at least the latest studies and research shows that like similar identity or backgrounds, like same gender, same like race, same sexual orientations, whatever identity markers, studies, as you know, shows that they do benefit in the short term, right? So if you're a Black client, seeing a Black therapist is helpful with rapport building in the short term, but over the long term, it dissipates and equalizes based on the competency and the actual skill sets and the actual emotional safety that the therapist is able to establish. So likewise, yes, maybe for a men client to see a men therapist might be beneficial in the beginning. It makes them feel more comfortable. And similarly, for a man, seeing a female or woman therapist in the beginning might be a little bit cringy and uncomfortable. But based on the comfort and the skill sets of the therapist, that barrier can get addressed, and it does get addressed over time.
Yeah, I'm glad that you brought that up, because also it could be supportive for the person. The client can evolve over time. Maybe someone that has more similarities to them can be really helpful. And then as their progress and as their journey evolves, then maybe they pivot or they shift to a different style or a different therapist that has things that can draw out things within them that maybe that didn't get drawn out because they actually had many similarities with their previous therapist. So it can be a very interesting dynamic around what is most helpful and beneficial to the client, to the person, depending on where they're at in their healing journey.
Yeah, I love system thinking as a former policymaker. And also I think power dynamics are embedded in all aspects of our life. One more personal curiosity, and then we'll get back into sexual health. You as an Asian descendant, Christene, like how did your parents react to your choice of going to sexual health and sex therapist? Because the first barrier is, what? You want to be a therapist, not a lawyer, engineer, doctor? That's the first barrier for most Asian folks. Generalized statements, of course. But the second barrier is, what? You're going to sex therapist as a woman, as an Asian woman? I don't know. That's some of the thoughts I had before hopping on the show with you. Just imagining that conversation, because I've never had a sex ed by my parents. Never. Until in my late 20s, they will casually say like, oh, as long as you don't do anything that you're going to regret for the rest of your life, implying like having kids when you're not ready, right?
Yeah, that's a great question, because I think it's a question that other people have been curious about, especially if they are more familiar with Asian culture. And part of how I managed that was that I didn't tell them. I didn't tell them. So they knew I was going to school for therapy. And then when I started the specialty in compulsive sex and sex addiction, which I started that specialty back in 2013, so about 10 years ago, they didn't know what I specialized in. They just knew that I was a therapist, and I didn't bring it up to them because similar to you, my parents did not speak to me about sex. I avoided being transparent with them about what I specialized in and how I have a mom and I have a dad, and how they learned about it. And maybe more so my mom. I actually, to this day, don't know if my dad knows that I specialize in this. But how my mom found out was that she wanted some of my business cards to give out to her colleagues at work, because she was like trying to help support me and like building my therapy practice. So she said, oh, give me some of your business cards. And I was like, oh, okay. Because my specialty was on there. So I gave her business cards, and they said certified sex addiction therapist or sex addiction. I forget exactly what they said. And when she saw that, she's like, she asked me to like go in the bedroom with her to make sure like no one was around in the house. And she lowered her voice and she said, what is this? What do you do? And that's how it came out.
Wow.
And I don't know if she told my dad that. My dad has never asked me about it, but that's actually not like all that uncommon for him not to ask about sex related stuff. He never has in my entire life. My mom barely has. Barely. So it's interesting, I think, for people to maybe think about that element too of there might be a misconception that someone who works as a sex therapist, like, oh, what did their upbringing look like in terms of their caregivers talking about sex? And maybe they were in a sex positive house and all of this. But the first time my mom directly, I'll actually put it in quotes, talked about sex to me was by saying, don't have S. Like, she wouldn't say the whole word sex. And this is me, and I'm in college, and I was going to go away for the weekend, and she said, don't have S. And then that was like the extent of the conversation.
Wow.
So the amount of, when you think about the amount of potential shame on her end or discomfort to not say the word and just say S, like that's very telling.
Yeah, even the way she whispered her voice and pulled you in the privacy of her very households.
Yeah.
Regarding your professional career on your business card.
And I don't know if they've ever seen my website, my business website. I think if they have, maybe they would ask questions about it, but I don't think they have. My business website, as you probably have seen, there's a lot of sexual health things on there. And even if sexual health is not innately shaming in itself, but the fact that I use sexual words because I'm promoting sexual health, that can be very uncomfortable for someone, especially as a parent or especially as an Asian parent.
Yeah, I I was laughing out loud in my mind because I pictured your dad, an old Asian man, trying to ask his daughter about sex and her practices, like just imagining the level of visceral discomfort they experience. Yeah, I'm sure he will never ask until the day he dies.
Yeah.
That's funny.
Yeah.
No, thanks for sharing. I was just curious because I do feel like even for a therapist, a lot of these practices have to start from home. Right? I'm a big advocate for every therapist, every life coach, every helpers must have one of their own. I just had my therapy session of my own yesterday, and anyone who's in our profession who's never seen a therapist, you're a hypocrite, period. Right? How can you help people in your profession if you do not or aren't willing to see the very profession of your own?
I have had some amazing therapists in my life, and I currently see a therapist also. So I think it's almost mandatory for myself to be able to not just have a more grounded life for myself, but that will ripple out to everyone in my life, my loved ones, the clients I work with, my friends. So I want to be able to ensure that I also do that work. And yeah, it would be concerning if I was working with a therapist who had never, ever done their own work around just the natural life shit that happens.
Yeah, life shit. The last comment I would say is a lot of like great therapists I've seen intellectually are actually very emotionally disconnected from within, especially a lot of PsyDs, a lot of clinical psychologists that are friends with mine. I think the greater your intellectual capacity is clinically and intellectually, I think you're better at self-intellectualizing your problems. And by doing that, you're actually getting farther and more removed from your emotional attunement. And I don't have a specific study to showcase that, but I think you agree. And I think all of us have people that are so fluid intellectually. They know all the right literature to cite. They're extremely great clinically, but then in their own problems, their life is falling apart. They're on their third divorces and their relationship therapist. I was like, hold up. You're on your second divorce and you help other people with their divorces? Help me understand that. How does that make sense? Or when you see a physician telling you the importance of healthy diet, but they're a beast themselves. Also help me understand that, right? So I think it's not mutually exclusive. We really need to take ownership of our own, to help other people to take ownership of their own life.
Yeah, I think it's imperative, at least for me personally. I don't know what I don't know. And I'm sure I have a ton of blind spots. So I would want to be able to have that support with the help of a therapist to be able to help me navigate that and help me manage and process trauma experiences that I've had and all of that.
So speaking of blind spots and we don't know what we don't know, I want to ask you, I think it's probably the thesis of your work, right? So like, Christene, what does it mean to liberate yourself from sexual shame and expand your sexual health? Because that's the bio on your social media, but I really do feel like liberation is everything that everybody wants liberation. Financial liberations, spiritual liberations, and in this case, sexual liberation?
I think liberating self from sexual shame would be being able to have a relationship to your sexual self that is not riddled with fear of how do I view this if I engage in this thing with myself or with another? How would society view it if I did this thing with myself or with another? What would my parents think if I did this thing with myself or with another? The idea of being so fearful around if I expressed myself sexually, what would the judgment look like? What would people say? And I think being liberated from sexual shame would be not necessarily, I don't care at all what people think, because I also want to be realistic. Like, you want to be mindful if you're going to do something that might cause harm to someone. I'm not advocating for that, but I am advocating for being more curious to what degree fear might be getting in the way of expressing yourself sexually. And being sexually liberated, or at least more sexually liberated, would be being able to express yourself sexually where fear is not the driving force around deciding how you express yourself or how you don't express yourself.
And what or how does that look like on the other side from your experiences?
I think how that can look on the other side would be feeling more connected to yourself when you experience any sort of sex. And that could be through masturbation, that could be with partnered sex, that could be having sex with multiple people, but feeling more connected to yourself. And that could be because it was a very pleasurable experience, a very physically pleasurable experience, so you feel more connected to your body. Or it was a very emotionally pleasurable experience, so you feel more connected to your emotional self. If you're able to feel more connected to yourself in some way, shape, or form, then I think that's how it can look, or that's how it has looked for the people that I have worked with.
It's almost like internally you're interrupting this positive feedback loop, right? Because people are going to partake in sexual behaviors, masturbations, or having casual sex with other people, regardless of the perceived shame and guilt anyway. So why wouldn't you want to remove the guilt and shame piece? Because I think by doing that, you can actually partake in increasingly safer sexual practices, be more responsible, be more mindful, and then also be more intentional as a result.
Yeah, and there is a quote that I really like. It's not mine. It's another therapist's quote, Esther Perel. It's something to the effect of, sex is not a thing we do. It's a place we go within ourselves and with another. And I really like that because there's the mechanics of sex, like the actual physical mechanics of sex, and that's one thing. But when you think about in a sexual experience, the place that you go within yourself, and what that relationship to self is like and what that experience is like. And then if you are having partnered sex, you're going to a place with that person, at least energetically or spiritually for some people, or emotionally. So it's not just a thing that we do, it's a place that we go.
Yeah, Esther Perel is amazing. Yeah, great psychoanalyst, psychotherapist. I mean, she's phenomenal. And I think that's so powerful too, because as you said, it's like nothing in this world lives in a silo, right? Everything is very complex and multidimensional. And as you said, on the surface, sex may seem like just a purely physical act, but it's not. It's psychophysiological. It's also emotional. And to many, it can also be spiritual, right? If you're really partaking in that mindful practices. And this is the reason why I think sexual health is such a powerful and important topic, just like food addictions and anything, because by liberating one aspect of itself, it trickles and compounds and eventually helps address the overall component, because like sums are comprised of its parts, but we are larger than the sum of our parts, And I really feel like it would be a very powerful like entry point to maybe address the larger issues. I would love for you to, share some, if you can think about where a lot of people come to us for a certain problem, maybe social anxiety, for example. I work with quite a few individuals with social anxiety. And then on the surface, it seems like, oh, they just have this agoraphobia. They're afraid to go out because of meeting with other people, or they can never raise their hands in classes because this excessive fear and phobia of social interactions. it's really tough. Like social anxiety is really hard to live with, right? Of course, it's a spectrum. But then through my work, I'm not a social anxiety expert, but I've had some experiences professionally. What I realize is, whoa, people who can work through and move through CBT, for example, for social anxiety, their own relationship with themselves also improves. And their relationship with their families also improves. And their grades improve, right? Because I work with a lot of students at USC at my last job. So it really, the benefits compound and ripple through all facets of your life, not just one.
Yeah, I absolutely agree with that. And sometimes you brought up something that I share with people also, is that we're not siloed. So if something is impacting your sex life in the bedroom behind closed doors, it's impacting your life outside the bedroom. It's impacting your non-sex life, and vice versa, because we're not compartmentalized in that way, even if we try to be. How can it not, if you really think about it? How can a concern you're having sexually, and if you have anxiety about it, and if it's causing stress for you and stress for the person you're having sex with, if it's a romantic partner, it might be casual sex, like how can that not impact your relationship outside of that sexual experience, and then vice versa. So it is when you work on one part of someone's life, it does ripple out. And similarly, if you don't work on one part of your life, that will ripple out also.
And that's why therapy or seeing a life coach or genuinely an unbiased, impartial, accredited helpers is very powerful.
Yeah, a legit person.
A legit person, not just a TikToker who read 20 minutes online, right? It's really powerful because of the parallel process, right? Just by engaging in this process with us parallelly, because I tell my clients, I don't care if you're the master grade A students in my session. I'm not a professor. You're not my students. There's no grades. I care about, are you mastering your life outside of this session? Because session's only 15 minutes to an hour once a week, right? And 1 hour a week, you shower longer than an hour a week, cumulatively over the week, right? So how can you hope that an hour a week will change your lives magically? We're not the Matrix. I'm not the Morpheus. I don't have a blue pill to give it to you, right? And so, but if you really engage with us and committed, move through your discomfort, your fear, if you work with us, the parallel process will show itself. And that benefits will trickle and it will show you outside of the container that we call therapy. But I think parallel process is so amazing. And we also benefit from our therapy session with our clients. Like I've had so many epiphany moments. I was like, holy shit, that applies to me and my life. Let me implement that after this session.
Yeah, therapy can be work for the client. I mean, also for the therapist, but for the client, it can be work. If someone is in therapy addressing whatever concerns they have, and they're mostly willing to only commit to that work when they're in the session, that's going to be a disservice to the person because you're living the rest of your life outside a session. It's like, what are you doing there?
Yeah, coming to therapy is not the work. It's a part of the work. It's a GPS navigation system to show you where the roads are, but you got to drive, buddy. You got here. Now you have the directions, but you got to drive to point B after that session. As you talked about what's happening behind the doors, it's also happening outside. So what are some of the most common sexual health concerns and or barriers that your clients come to you with? And also any identified contributing patterns from your experience, aside from a small sex of like porn that we talked about?
I would say one of the most common ones, if I am seeing a couple, it would be that there's a discrepancy around how often they want to have any sort of sex. So if it is one partner wants to have any sort of sex more often than the other partner, that's the most common concern that I have that gets brought to me when it's a couple, the discrepancy. There's that piece. And then if it's an individual, I would say the most common ones would be difficulty getting or maintaining an erection, or coming more quickly than one would like, or pain around sex. So let's say pain with intercourse, or pain with some sort of penetration, whether it's with a finger, a toy, a penis, there's pain around it.
Is that pain, because I've heard that before, like is that pain more or less associated with their past sexual trauma, or is it more physiological? Of course, I'm sure your answer is all of the above, right? But from,
all the above. Yeah,
but from your experiences, will having sessions with you or having therapy with having sex therapy actually improve their physiological or somatic symptoms in terms of like pain?
Yeah, that's a great question. I think it depends on what's contributing to their pain, because there is an element of, if it's something biological or something physiological, then there might be exercises that I would guide clients through to do outside of session. That might be, let's say for a woman, it might be dilator therapy. So she's using different dilators and inserting them inside her vaginal canal, and not far in, but it's very guided around like how far to go and what size to use and like how to move it around. There is work that they're doing that's not just talk therapy, but that work is happening outside of the session. But it's still somatic work that they're doing.
I think that ties into something you talked about with your podcast, Heal Thyself with Dr. G, where my team discovered you actually. One of the things you two talked about was how sexual trauma from the past, whether it's rape, sexual assault, or just the negative sexual experiences, will actually remanifest itself in the present tense while you're engaging in the current sexual behavior with someone else. And this is like a subconscious response psychophysiologically. Can you elaborate on that and how that happens? Because I think we're in the realm of mind-body paradigm.
For people that have experienced that, the sexual trauma, or let's say it's a rape or an assault, they might be very attuned to the fact that they're having a partnered sexual experience with someone and getting triggered. And they might have a very clear understanding around what's happening and be able to name that. And for someone else, it might be very confusing. I'm pretty sure I mentioned it in that podcast episode, but for someone who's very confused by it, they might intellectually say, oh, this person that I'm going to have sex with, I like them, I trust them, I'm very attracted to them. Like, all things are saying this is a safe experience, but their body might not be responding in that way. And their body not responding in that way could look like maybe not lubricating as much, or losing their erection, or not being able to get an erection. Like, there's different ways that the body can respond. And sometimes there's many reasons the body can respond that way, but sometimes it can often be from anxiety or from the experience triggering past sexual trauma. That happens pretty often for people if they have experienced sexual trauma, depending on what the trauma was and depending on to what degree they have worked through it.
Yeah, the body keeps the score will be a great resource, right? Yeah, the mind-body paradigm, it's a thing, right? Of course, there's still a lot of skeptics around it. But obviously, like EMDR, amazing trauma-based therapy modality, is based on mind-body paradigm, mindfulness, MBSR, mindfulness-based stress reductions based on mind-body paradigm. But our bodies are truly, like I talk, because I do mindfulness with my clients as well, and also myself. I tell all my clients, and even my friends and my family, pretty much anyone who are willing to talk to me, I tell them that like your body withholds the ancient wisdom that is beyond our intellectual grasp. And your body is the perfect accountant. It takes notes and remembers and take account of every single thing that happened to you. And they do manifest if you do not address them head on.
Yeah. And because of the specialty that I have, and I work with a lot of people who've experienced a wide variety of sexual trauma, it absolutely gets stored in the body and it manifests in ways that can be very confusing for people and very harmful for people, unfortunately, and then also discouraging for people because they're like, why is my body responding this way? It feels like my body's working against me. That's something that I hear pretty often. My body is not working for me, it's working against me. And the body is always trying to protect us, even if it happens in a very inconvenient way sometimes, or in a way that is confusing to us, but it's always trying to protect us. And I want to bring up an example, piggyback off of the example that I gave a few moments ago of someone about to have a sexual experience with someone, and intellectually they're like, oh, I want to do this. They're safe, but their body's not responding in the way that they want it to. In a different experience, if someone is about to experience sexual trauma, like let's say they're realizing they might get sexually assaulted, or they're realizing they're in a situation that they might get raped. And let's say that's a woman. She might actually lubricate before and during that experience. And that can be very confusing because people might say, oh, you got wet or you lubricated. Does that mean And she might view that about herself. Does that mean I wanted this? Did that count as rape or sexual assault? I got wet. Does that mean I was sexually aroused and horny? But that's another example of the body trying to protect itself. And that can be very confusing for someone. Because if the body lubricates and you're about to get penetrated by something or someone, that might decrease the likelihood of there being pain that's happening from, it could still be very painful, of course, but it might decrease a little bit the amount of pain that a woman is experiencing if she's getting raped, but her body's responding to try to protect her by lubricating. So I want to bring up that example because the body is always trying to protect us. It might just happen in some seemingly odd way, or a very confusing way, or a way that might unfortunately add shame, like in that example, but it's always trying to protect us.
Damn. Well, that's crazy because I have heard many recounts of similar experiences, right? And also it's a really screwed up thing to say, but a lot of like repeated offenders and perpetrators, they actually derive their pleasure from seeing that. Their victims getting wet, seemingly, air quote, enjoying getting raped experiences. That's how they derive their power, right? Because it's all about power at the end of the day. And another thing I like to really echo that message, because I think that's probably one of the most important things from this conversation alone, is our body, especially our brain, is about 3 million years old. 3 million. You can be the most cognitively aware, awakened, intellectual person. You could be 150 years old. 150 has zero chance against the evolutionarily primed psychophysiology of human beings. 3 million years old. So your body and your mind will do certain things to maximize survival, period, right? Another example is fight or flight or freeze, right? Your endorphins, adrenaline, dopamine increases, your dilates, get smaller to really create this tunnel vision so that you can optimize your response to the perceived threat in front of you. But then you experience psychological and physiological crash afterwards because all of us have a finite amount reservoir of energies. It's not unlimited, but our bodies, because of evolutions, has the ability to withdraw, air quote, borrow from your future reservoir, but it comes at a cost. That's why addiction is scary because your dopamine spikes a lot, but afterwards your dopamine actually goes below the reservoir level and plummets to the negatives. And you feel like, oh, I feel horrible. Man, I had such a fun time last night. Why do I feel like shit? Duh, you drained your reservoir of energy and dopamine. But similarly though, like the example you said, biologically, physiologically, a lot of women's, their bodies do respond innately without their awareness to protect them. It's the same phenomena as fight, flight, or freeze. It's the same thing. And I think it's really important for us to know because if we let this misconception left unchecked, saying that, oh, just because a woman's getting wet or lubricating before they're about to get raped or like a very dangerous situations, we don't want to undermine that. That physiological response has nothing to do with just the horrible act of sexual assault.
Yeah, and I want to add another trauma response to the fight, flight, freeze. Are you familiar with FAWN?
Oh.
FAWN?
No.
Yeah, I think that's an important one to be aware of too, and especially for our listening to this, because fight, flight, freeze are the more common trauma responses that people are aware of. Fawn is also another trauma response, and it comes up for a lot of people when sexual trauma happens. And with fawning, that response is essentially when the person responds by, when someone fawns, they are trying to decrease the likelihood of potential harm. What fawning might look like is it might look like they are consenting to something because they are trying to decrease the potential harm in whatever experience might be happening. And that, I want to highlight how important this piece is because this can add to, not knowing this, can add to the shame for someone who's experienced trauma or especially sexual trauma, because it might look like they're consenting. Or the person might say like, oh, if I don't consent to this, what if they hurt me more? Or what if they rape me again right after this? Or, there's some sort of way in which they're trying to calculate, how do I decrease the likelihood of the harm that's about to happen? And the calculation can happen in a millisecond. So fawning can look like consent, but it's not. fawning can look like a choice, but it's not. And those two, fawning and freezing, often go together when a sexual trauma is going to happen. Because someone can freeze and like they don't know what to do. And then they can also be fawning because they don't want more harm to happen. So what that can look like them not fighting the perpetrator off. That can look like them just their body is there, but they're not really moving. And it might look like, oh, this person's consenting. They're not fighting off. Trauma, it could be very much so could be a trauma response of them freezing and fawning at the same time.
Right. Because a lot of the rebuttals or defense that a lot of accused offenders have is, oh, they didn't say no.
Yes.
When you're facing a predator that's larger than you are, stronger than you are, more powerful than you are, like humans versus like uncaged tigers and lions, you think you have the ability to say no? Like you said, in a milliseconds, with this 3 million years old evolutionary primed brains of ours, you already made that calculus. It's instantaneous. And when you're facing perceived doomed reality, you just freeze. You don't have the audacity or the energy expenditure to say no, because your body's reserving and optimizing every energy that you have to survive. Like yes is a yes. But with fawning that you just talked about, that's also another layer of nuances.
It's the body's reaction. So it's not a response. When you think about response and reaction, like reaction is more so it feels like a knee-jerk reaction versus a more mindful, intentional response. And with fawning, it's the body's reaction to try to avoid potentially inescapable harm. And that on the outside might look like consent. But if there are people that are listening to this and that they have experienced sexual trauma or know someone that has experienced sexual trauma or sexual assault, I think that knowing that piece is very important. That fawning is a trauma reaction, a trauma response to try to protect oneself, and that it's not your fault if on the outside didn't look like you were kicking and screaming and fighting. But maybe it's because like, holy shit, you're in a really shitty, unsafe scenario, or you're having the feeling that you are, and your body's trying to protect you by quote unquote going along with it. Might be the judgment that someone has, like, I just went along with it. But part of that is because you were trying to protect yourself from something potentially more dangerous happening to you.
Yeah, I love the highlights between reaction and response. Reaction is your action is in like you're reacting, right, which is more, I guess, compulsory or more just instinctive versus
knee-jerk, automatic, like trying to protect self, the body trying to protect itself.
Right, like automatic thoughts versus responses. There's usually more pause in between. And wow, I didn't think we were going to get this heavy, but of course, sexual trauma is part of sexual health. And we have to recognize every facet of anything as we started this conversation to address the whole. Because the whole is often larger than the sum of its parts, as we talked about. I'd love to hear more about the most profoundly challenging period of your life dealing with your medical condition of topical steroid withdrawal, or colloquially known as red skin syndrome. During our offline qualitative process, I've never heard about that medical condition before. So I Googled it. It's pretty gnarly. It's very visual, to say the least.
Yeah.
So part of me was wondering whether that played a role in you becoming a mind healer, aka therapist yourself, and or just some of your takeaways or some of the experiences. Because I'm not sure you know, but the concept about post-traumatic growth, right? PTG, right?
Yeah.
Most people talk about PTSD. I'm a veteran. It's extremely real, very complex, very, very difficult to deal with. But some people, or even many people going through a very, very traumatic, either it's a warfare, sexual trauma, or any other thing in between, can actually come out on the other side once you move through your healing with this profound thing, psychological phenomenon called post-traumatic growth. You take away something very meaningful and actually act as a strength stimuli. I like to call things that happen to us either as like a growing pain in life or a stimuli that makes you stronger. Ergo, strength stimuli. I would love to hold some space and for you to share anything you feel called to regarding your experiences with your own condition.
I'm really glad to be able to share about this because I think it also there's such a mind-body connection around experiencing an iatrogenic illness like I experienced, and how that impacted my own sexual health and tied into just my health in general. And other people may have struggled with or know someone that knows someone who struggled with that. So one of the biggest life experiences and life teachers that I have had is this medical condition that I struggled with for several years called red skin syndrome, aka topical steroid withdrawal. It's an iatrogenic illness, meaning it's an illness that was caused by medication. The medication was steroids because I was using it to address eczema at the time. And the scary thing about steroids is that a lot of people might use it and not know they're using it, because they might be using it in an over-the-counter product like hydrocortisone for an itchy rash or an allergic reaction to something. So people very much so can often be using this medication and not know they're using it and not know the side effects that they might experience from it. And I unfortunately was one of the many thousands and thousands of people that experience a reaction, a very life-threatening reaction to this medication. Visually, I looked like a burn victim. And I think maybe you saw photos of that when you Googled what this condition looks like. And physically, I don't know what a burn victim feels like, but I imagine it wouldn't have been like too far off. And it was like just highly, highly painful and uncomfortable, like all over my body, essentially looking and feeling like a burn victim. But also there's an insatiable itch that came with it on top of looking and feeling like a burn victim. It's very hard to describe. I think if people were interested in learning more about it, because they might know someone who knows someone and not know that they know someone, being able to Google image that condition and read about it and get a better understanding of it. But during that time, I was in a romantic relationship during that time, and very blessed to have had the support of that partner at that time and the support of loved ones at that time. But with that type of condition, it's taking such a toll on my physical health, definitely, but on my mental and emotional health, because of how debilitating a condition like that is. And how it's really interesting, because with a condition like that that's so physical, I felt every pain on my body and how much I wanted to dissociate from that because of how painful it is. And I imagine how similar that can be for someone that has experienced either chronic pain in their body or some sort of physical trauma, how much you want to dissociate from your body to not have to feel that, or try to, even if incrementally, feel it any less. So a big part of me wanted to dissociate from my body, but I couldn't. It was too physically painful to be able to do that, because even just laying in bed, even if I'm not moving around, I could feel the consequences of this condition and how painful it was. So it's a really interesting, life-changing experience to have something like that for so long, because I experienced that over the course of several years. And I was already a therapist at that time. This wasn't a specific experience that propelled me to be a therapist, but it definitely changed not only me as a person, but it changed how I view the world, how I relate to people, because of how profoundly dark an experience like that is, and how much it's really hard to put into words. It's really hard to put into words. In some ways, it feels like a different life, because I think in some ways I had to make it a different life to be able to work through how traumatic that was. And it gave me a deeper perspective on others that have experienced a trauma like that, even if it may not have been the same type of trauma, but just a physical trauma or trauma that manifested in the body like that. Yeah, it's a different world. It's a different world to experience something like that. And it profoundly changed me.
Mm-hmm. Aside from walking away with increased awareness regarding the difficulties and the potential harm of over medications that United States subscribes to, right? Because over-the-counter drugs and the medical trauma and knowing the ineffectiveness of this managing sick care, right? Because America doesn't really have healthcare. It's more of a sick care system. It's all about symptoms, symptoms, symptoms. So aside from walking away from that systematic awareness, just to probe you a little bit further, Christene, of course, it changed you because all of us are comprised of who we are. And that who we were helps us to become who we are and allows us to propel to become who we want to become. Did you walk away with any other things about yourself aside from knowing how resilient we truly are?
I would like to say I had this before that experience, because in part I did, but an experience like this gave me a invaluable, much deeper gratitude of my health, because there are so many things that need to be operating in the body for us to just be sitting here and being able to breathe okay and be able to move our bodies in a way relatively pain-free, and so many things that have to be operating to have a healthy body or a relatively healthy body. And an experience like that deepened my gratitude so much for me to be able to do things that I think naturally we take for granted, like being able to sit up pain-free or walk pain-free or move your neck pain-free, because these things I could not move my body or make facial expressions without my skin tearing the different parts of my body I might be moving because of how damaged my skin was during this process. So that is probably one of the biggest takeaways, was to not take my health for granted. And again, I to some degree, I like to say I had that before, but an experience like this, I couldn't have replicated the gratitude I have now without having gone through an experience like that. I can only intellectualize it so much if I had not gone through an experience like that. The firsthand experience of what it's like when there's an absence of being able to move your body in that way, and when that has been robbed of you, when that has been robbed of me to be able to move my body freely.
I resonate deeply because I've had quite a few near-death experiences, not the spiritual NDE, but almost dying, army stuff. I was in a couple complete total car crash in Philadelphia. I only survived because I had a spare tire that absorbs 90% of the impact, but I couldn't move my neck. I couldn't go into work for 3 months, had intensive chiropractor therapy as well. Fortunately, I was alive and now everything's fine now. But I share that too because, as you said, health is probably one of the most elusive things that we have. When we have it, it's a constant, it's a norm. It's like breathing. You don't think about breathing when you're breathing unless you meditate, breath in, breath out. But the moment you don't have it, you would do anything to take it back. One of the most powerful thought experiments I've seen online is if you ask any billionaires, you can replace that with anything that you aspire, right? Fame, famous, billionaire status, anything. Are you willing to trade your entire net worth of $50 billion or fill in the blank with longevity and or health? 99% of them will say yes without a blink. Sure, they have the knowledge and ability to do that again. If you've gotten that level of stature, I get that. But at the same time, if you ask any one of those people that you respect to trade health for something else, no one will do it. So conversely, why are we doing all these things like working till we die, right? Hustling, no rest, sacrificing your sleep hygiene, all these things to strive for the things that you're going to instinctively trade to reclaim your health back years down the road. It's a very counterintuitive and almost the opposite way of life.
I think the idea of when people lack the rest or pausing or slowing down their body or the level of stress because they're overworked, that if we don't slow down, our body's going to force us to in some way, shape, or form. Your immune system might get shot and then you get sick. And you're like, oh, I have to take a day off work or take X amount of time off. Like something will slow down your body, because if we're like working at it to a certain capacity that it should not be working, or if you're sleep deprived and all of that. And I think it's also shifting the idea around, for some people, they feel as though they have to deserve their rest.
Mm-hmm.
Have I worked hard enough to be able to rest? And there might be guilt if I haven't worked hard enough to deserve this 3-day weekend, deserve this vacation. I didn't work hard enough. And I think it's really shifting that mentality from, have I worked hard enough to deserve this rest, to have I rested enough to be able to do the things that I enjoy doing, or to be able to hang out with the people that I love spending time with? Because the rest and the health is like the foundation to ripple out. And I know can be like a cliche idea of like rest is everything, sleep is everything. At least for my own personal experience, where I was extremely sleep deprived because of the health issues I was going through. It was hard to fall asleep when you're in that level of pain. But if sleep is the only way to escape that pain without using a different drug that can help you escape it for a period of time, which I didn't do, you don't have nothing. If you don't have your health, you don't have anything. What is all the material things you have, or the money that you have, if you don't have your health? How can you like actually enjoy those things if you don't have your health?
You need the engine to have great horsepower. You can have the nicest cars, and of course these are tropes, but these are really important stuff. And yeah, I really wanted to hold space to spotlight that story, because you told me how meaningful it was. And of course, any life-changing experiences are profound. At the same time, I really wanted to use that to like close us out, right? To really highlight the mind-body paradigm. And also we have to work on all facets of a relationship with ourselves, whether that's physical health, mental health, or sexual health in this conversation. Because I love relationships. Like primary attachment theories aside, I love relationships because no other container spotlights your relationship with yourself more than your relationship with other people. Because when you do not have a relationship with yourself, when you do not love yourself, accept the good, the bad, and the ugly about yourselves, why are we expecting other people to accept us for who we are? When your relationship with yourself is not even cohesive, it's not even worked on, right? And I think sexual health is just a facet of that. But I think whatever entry points you want to pick, this is why life is great. It's like life's like a buffet. There's so many other entry points and vehicles for change. Just pick a vehicle, work on it, see where it takes you. And I promise you they'll ripple through to a different vehicle, a different aspects. So then everyone does abide by a different timeline, which I do believe. So before we close this out, before I ask you to roll out the red carpet for you, Christene, is there any other thing that you feel like is really important for you to spotlight, maybe for you to project onto a giant messaging board before we close out today's conversation?
I think it would just be that sexual health is so important. And maybe that goes without saying because I specialize in this. But I want to just reiterate how important sexual health is and how much it ripples out and can infiltrate different parts of our lives if we don't look at it, if we're not curious about it, if we don't address it or attune to it. So I just want to highlight that.
So how can the people discover more about sexual health and everything in between from you or with you?
Probably one way that people can find me is through, I have a business Instagram account, and it's Meraki Counseling. I don't know if you'll have show notes to help people spell that.
We do.
It's spelled M. We do. Okay, so I don't have to spell it out. Mm-hmm. People can look in the show notes and find that, and that would be one of probably the quickest way to find me. And then through that social media, you'll be able to see in my bio different links where you can reach my website and articles that might be helpful and things like that.
Yeah. Whether you're just looking for just a tip, pun intended, or you want to go much deeper, also pun intended, Christine's got it all. So I strongly encourage everyone to check it out. And part of me was trying to see how many immature, childish puns we could fit into, like sex puns, into this conversation. Yeah. But the conversation got real heavy, so I chose not to do that. But seriously, I really appreciate your thoughtfulness. I really do believe in and respect the work you do. I think there's many vehicles for change and many avenues for change. And I appreciate you choosing to tackle on a very complex and nuanced topic like sex therapy and sex addictions. But I appreciate for your time today.
Yeah, thank you for having me. And I hope this was helpful for the people that are listening, because I would want everyone deserves to have a healthy sex life, whether that is with yourself or with a partner. So hopefully listening to this gave a little bit of a gateway to explore that more with yourself or with another person.
Awesome. And to everyone that's listening, thank you for tuning in. Before I let you go, can you just do me one favor? Is I ask you to share this episode with one person only. It's free for you and effortless for you, but it's invaluable for the podcast's growth. So we can keep bringing on amazing people like Christene who will like to just create some positive impact in whatever way that's meaningful to us. And until then, as always, I hope you choose curiosity over fear and hope you do discover more something about in your own life after this conversation. And thank you for tuning in. Until next time.